Hi, welcome to Healthy Living. I'm your host, Amy Bouton. We are here today with Dr. Rob Faucheux. He is a general pediatrician here for St. Tammany Health System, and we're going to talk about a lot of things today. We're going to talk about pediatrics in general, his practice, but we're also going to talk a little bit about autism awareness because April is Autism Awareness Month. So we are so glad you joined us today.
Thank you, Amy. I'm glad to be here.
So tell us a little bit about yourself. I know that you are probably known by lots of parents in the community, but for those who don't know you, tell us a little bit about yourself.
Well, you know, I went to Holy Cross. That's a big thing in New Orleans area. Where did you go to high school? So I attended Holy Cross, went up through LSU, did my medical training out of LSU in New Orleans, and then went on to residency through University Hospital and Children's Hospital in New Orleans. Did an extra year at Children's as chief resident of pediatrics, and then went out into private practice, where I've been doing this for about 20 years now, 5 to 6 of which have been with St. Tammany.
Okay, and where is your practice located for people who might not be aware?
That is a great question because, you know, we were located in Covington and then Ida came through and destroyed our building.
Right.
So we are now transplanted back to Madisonville, which is kind of where we started on Highway 22. We have hopes within the next 2 years, though, to get a nice, beautiful building put where we were before and become just kind of an overall general pediatric center of excellence there, where we'll have more services and labs and that type of stuff that kids will need and make it easier for the parents that way.
Yes. So, well, that's good. Good to know. Good to know where you're located, where people can find you. Let's talk about the practice itself.
Okay.
So when we're talking about Autism Awareness Month,
yes,
we have some certified autism centers within some of our clinics here in St. Tammany Health System, and your clinic is a certified autism center.
Yes.
So can you tell people who are watching, what does that exactly mean? What did you kind of have to do to get that, and why? Why is it important to have that?
Well, it's important because we can't have children who come to our office with a diagnosis of autism get treated like all the other kids. They have certain considerations that you have to bear in mind. Most kids with autism are going to have some sort of need for order or just a regimen that they are comfortable with. So you can imagine if they walk into a waiting room, something like we all take for granted, and there are crying children, and there are parents telling their kids to do things, and there's a TV on and all of these different things, it can be really off-putting for them. So everyone from our front office ladies to our nurses to our physicians went through this certification process. It was offered through the International Board of Credentialing and Continuing Educational Standards, and it's ICBCES, which is a lot easier to say than all of those words. But what it did was it allowed us to do modules over a period of, if you added them all together, it's probably 18 to 24 hours of training, where we learn from behavioral specialists, physical therapists, psychologists, the ins and outs, to the extent we could learn in such a brief period, of how maybe to better approach those kids with those concerns. One of the things that we're enacting right now as a result of that is we are, with the help of a behavioral analyst out of Baton Rouge, we are putting together a little booklet that is based on a principle called video modeling. And it's all about having them be able to come into the office and provide them with this book, where it's basic pictures with very small captions underneath that tells them the process that they're about to go through. So the nurse, there's a picture of a nurse coming to the door to call you back. There's a picture of a nurse telling you, you know, we're going to do your weight and we're going to do your vital signs, because we feel that if they can get a little bit of a preemptive look at what's coming up.
Yeah, know what to expect when you walk through the door.
It's an easier transition for them.
Right.
And it makes it a much more pleasurable process for both the child and the mom or the parents. What we like to also make a note of is that we don't, even though we're certified for autism, we do not make the autism diagnosis. That sometimes is something that gets confused in the process. What our training is for is just better to be able to relate to those children and make it an easier process when they come in for their routine health care. To get a diagnosis of autism, we can help facilitate that. We can have them come in and discuss that, but it's not something we would do in the confines of our office or during a visit with us. For that, we would probably refer on to we have a nursing navigator in our office, where we would refer those parents to, and his job would be to look at what they're looking for as far as what kind of diagnosis they're considering,
Right.
what their insurance is, where do they live, and all of these different factors to best fit them into a place where they can go at the most convenient way, at the most economical way to get that diagnosis made.
Yeah.
Once that's achieved, then we kind of take it from there in their daily care.
Okay, so I want to just reiterate that you know, when this autism certification it equips you and your staff with the tools to work with the families of autistic children to make their experience pleasant.
Exactly.
Because they have to come in for physical exams just like every other child, and they need their yearly interaction or more. And so it helps the parents and the child. But and you were talking about when a parent would like to seek a diagnosis or thinks that they might need one, that you have the resources to refer them to. But not necessarily make the diagnosis. So do you ever kind of work with parents and say, you know, let's talk about what might be happening with your child, and how does that work? And what are some of the things that parents might look for?
Yeah, that's a great question. You know, every time a child comes in, at least in our office for a well visit, there is a questionnaire that they'll fill out of their child's development, where their milestones are, what they're doing, what they're not doing. It's usually given in the form of a little iPad questionnaire they do while they're waiting in the waiting room. It gets transferred to our medical record, and then we see it usually before we walk in the door.
Right.
So that would be my first go-to, would be, you know, are we making our milestones? Are we where we want to be developmentally, and those types of things. Then you kind of get to the intangibles, where you go into the room, you talk to the parent, and a lot of times when we're dealing with autism, it may not be as simple as they're not meeting milestones.
Right.
It may be more of an intangible, they're not making eye contact, or when they're in the playground, they're kind of off by themselves. And I don't want to, saying these things, I don't want to give the general public concern that if they do have a child or a grandchild who has some of these things, that it is necessarily autism.
Right.
But we do look for those types of things, which then kind of points us in a direction. And I always tell my parents, don't get hooked up on, or hung up, I should say, on the diagnosis, the word autism.
Right.
How I tell them is that, you know, every child's brain is different. And just like a computer, some computers work off of a keyboard and some of them work off of a mouse. And it just depends on how we need to know how that information gets into their brain,
right,
so that we can better adjust our approach to their education and their development. So that would be the first thing we would do, would be the questionnaire, talking to the parents. And then if we both came to a mutual understanding that, yeah, there was a concern what maybe we want to look into, that would initiate our process as far as getting the evaluation done.
Okay. So how do you think, since the certification came into being, how do you see that it has impacted you and your staff and your patients in a positive way?
I think it makes, I would like to think, it makes them feel more welcome. And I think there are times for these parents and these kids where whenever they go into a new environment, there's always this angst of, is this going to be a meltdown episode, or is this going to be something that sometimes parents find embarrassing if they're in public and stuff that way? We try to look at it as we can minimize those concerns, because we are a little bit better trained to know how to approach them in a certain way.
Right.
And you know, the saying that I have heard that I like the most is, when you've met one child with autism, you've met one child with autism.
Right.
Because they're all different.
Everybody's different.
Exactly. And in pediatrics, we do have the luxury of kind of knowing these kids and knowing these parents on a personal level. So from the time the ladies in front raise their eyes and see them coming in the front door, we know kind of how to approach that individual child. And so we try to just facilitate ease of evaluation. It helps the parents, it puts them at ease, it helps the kids. It actually helps the physicians too, because we're there to try to assess them, examine them, do those things. And it's much easier if they're more relaxed with the process than if they're screaming and crying and upset. So it helps everybody, not just, it's a little bit selfish for us, in fact, because it helps us as well.
Sure. Well, thank you so much, Dr. Faucheux.
My pleasure.
This has been a wonderful conversation, and we look forward to many more with you.
Thank you.
You can find Dr. Faucheux in Madisonville, and we will have all his details for you, so you can get in touch with him and make an appointment if you need to. So thank you so much. Stay tuned for our next segment. We're going to be meeting with Lori Cage, Executive Director of our St. Tammany Parenting Center.